Next, we'll discuss Raynaud's disease. This is a benign vascular condition that affects small vessels. It is characterized by sudden decrease in blood flow due to arteriolar vasospasm in response to cold temperature or emotional stress. As shown in these pictures, the fingers are most often involved. One important thing to remember is that when this happens in the context of any connective tissue disease or other inflammatory condition, such as SLE or CREST, it is known as Raynaud's phenomena instead of Raynaud's disease. Let's move on now to vasculitis, which is inflammation of blood vessels. This can be a confusing topic for students because there are a lot of details to memorize, but these tend to be very high-yield topics on the exam, so let's pay important attention to these specifics. Although we won't cover everything here, let's go through and highlight some important concepts. First of all, it's helpful to think about vasculitis in terms of the size of the vessel that's affected, large, medium, or small. Let's start with large vessels. The first large vessel vasculitis to consider is temporal arteritis, also known as giant cell arteritis. In this disease, which typically affects elderly females, large arteries in general, and specifically branches of the carotid artery, are affected by focal granulomatosis inflammation. Classically, this happens to branches of the carotid artery, specifically in the temporal artery, leading to unilateral headache and jaw claudication. Jaw claudication is pain upon repeated use of the jaw, such as when chewing food. However, the most serious consequence of this condition is when the inflammation happens in the ophthalmic artery, which can produce irreversible blindness. For this reason, when a patient presents with symptoms of temporal arteritis, it is very important to confirm the diagnosis with biopsy and then begin treatment immediately with high-dose steroids. The next large vessel vasculitis is Takayau's arteritis. This disease typically affects Asian females younger than 40, and it is also granulomatosis inflammation. But in this case, it's the aortic arch and the great vessels that are affected. Because these vessels supply the upper extremities, this condition is sometimes known as pulseless disease, due to the weak upper extremity pulses. Other symptoms include fever, night sweats, arthritis, myalgias, skin nodules, and ocular disturbances. Now, let's move on to vasculitis that affects medium-sized vessels. There are three important conditions to keep in mind, and as we talk about them, we'll make sure to highlight how to keep them apart. First, let's start with polyarteritis nodosa, or PAN. This is a condition that typically affects young adults and manifests with a variety of symptoms including fever, weight loss, abdominal pain, melena, hypertension, and cutaneous eruptions. Interestingly, there is coexistent hepatitis B seropositivity in 30% of these patients. Pathologically, PAN is characterized by immune complex-mediated transmural inflammation of the arterial wall, often with fibrinoid necrosis, and usually affecting renal and visceral vessels. These lesions are of different ages. On arteriogram, there are multiple aneurysms and constrictions. The treatment for PAN includes corticosteroids and cyclophosphamide. The next disease to consider is Kawasaki's disease, which classically affects children younger than 4 years of age and more commonly affects Asian children. Symptoms include fever, conjunctivitis, as well as changes in the lips and oral mucosa that are known as strawberry tongue, which you can see in this picture. There is also erythema and desquamation of hands and feet. The risk with this condition is that it can lead to coronary artery aneurysms, so it is typically treated with IV immunoglobulin, or IVIG, and aspirin. The final medium vessel vasculitis is Buerger's disease, also known as thromboangiitis obliterans. The easy way to remember this disease is that it's a disease of smokers. It's also more common in males younger than 40 years old. Common symptoms include claudication of digits that may result in gangrene and autoamputation, and possibly Raynaud's phenomena, which we've already mentioned. The only real treatment for this condition is cessation of smoking. Finally, let's discuss the vasculitides that affect small vessels. There are 4 important diseases to consider here. 3 of them are positive for some type of anti-neutrophil cytoplasmic antibody, or ANCA for short. Wegener's granulomatosis is the odd one out in that it's positive for C-ANCA and not P-ANCA. This is a condition with a large number of symptoms depending on the vessels that are involved. This may include upper respiratory symptoms such as perforation of the nasal septum, chronic sinusitis, otitis media, and mastoiditis. Lower respiratory symptoms such as hemoptysis, cough, and dyspnea, and/or renal symptoms such as hematuria and red cell casts. The classic triad of pathological findings is focal necrotizing vasculitis, necrotizing granulomas in the lung and upper airway, and necrotizing glomerulonephritis. Wegener's is usually treated with cyclophosphamide and steroids. The other 2 conditions are both positive for P-ANCA. The first is microscopic cholangitis, which is characterized by a lack of granulomas and is a necrotizing vasculitis commonly involving the lung, kidneys, and skin. This is pauci-immune glomerulonephritis and has palpable purpura. The second is Churg-Strauss syndrome, which is characterized by asthma, peripheral neuropathy, and granulomas with eosinophilia. Be careful in distinguishing these last 2 because they both are pauci-immune conditions that are associated with palpable purpura. The final vasculitis to talk about is Henoch-Schönlein purpura, or HSP for short. HSP is an immune complex disease associated with IgA complex deposition, leading to vasculitis and IgA nephropathy. It is common in childhood, especially after an upper respiratory infection. The classic triad of HSP is palpable purpura on the buttocks and legs, as you can see here. Arthralgia and GI symptoms are also found, such as abdominal pain and melena. Next, let's go through vascular tumors. This table is a high-yield list of diseases that might appear on the exam. As with the vasculitides, there can be a lot of details to these, so we'll focus only on the most salient points as we move through. Strawberry hemangiomas are benign and associated with infancy. They typically regress spontaneously over time. Cherry hemangiomas are also benign, but these are usually associated with old age. They do not regress, and they are much smaller. Pyogenic granulomas are really misnamed. They are capillary hemangiomas that are prone to bleeding and are associated with trauma and pregnancy. They are neither infectious nor are they granulomas. Don't be tricked. Cystic hygromas are cavernous lymph vessel tumors found especially in the neck, and they are associated with Turner syndrome. Glomus tumors are benign, painful red-blue tumors that are found under fingernails. These arise from modified smooth muscle cells of the glomus body. Next, bacillary angiomatosis are skin papules found in AIDS patients. They are caused by infection with Bartonella henselae. They are commonly confused with Kaposi's sarcoma, which we'll discuss shortly. Angiosarcoma and lymphangiosarcoma are both malignant cancers. Angiosarcoma are rare blood vessel malignancies typically found in the head, neck, and breast areas. They can also be found in the liver. They are very regressive and difficult to resect due to a delay in diagnosis. Lymphangiosarcomas arise from lymph vessels in the setting of persistent lymphedema, such as after a radical mastectomy. Finally, Kaposi's sarcoma is an endothelial malignancy that is caused by HHV8, and it is strongly associated with HIV infection. As we stated before, it is commonly mistaken for bacillary angiomatosis. Our last topic to mention as we finish talking about cardiac pathology is Sturge-Weber disease. This is not really a vasculitis because it's not inflammation of the vessels. Instead, it's a congenital vascular disease that affects small blood vessels, leading to port wine stains on the face, along with ipsilateral angiomatosis of the meninges and resulting arteriovenous malformations. AVMs will be covered in more detail in the neurology section. This ends our review of the cardiac pathophysiology. Next, we'll go on to discuss more of the drugs used to treat these diseases.